How does an at-home allergy test work? Most at-home allergy tests use a technique called dried blood spot testing. And what happens is you prick your finger with a small lancet and you apply your blood drops to a sample card. This sample card then preserves the sample so it can be tested by a lab later on. This technique initially gained popularity for testing newborns because it was a way of getting a test sample without having to take a lot of blood, and this was in the 1960s. Recently, the technology has now been adopted to test for IgE, which is the antibody associated with allergies. And thanks to CLIA certification, we know this type of testing is clinically valid. How long does allergy testing take? Allergy testing takes different amounts of time depending on what kind of test you use. So if you do skin prick testing, it usually takes between an hour to two to go get your skin stuck 60 times at an office, and then we have to check in and follow up to see what the results are. If you want to do blood testing, it can take substantially less time. So you can go to a local lab like Quest Labs or LabCorp and have your blood drawn. That takes about the time it takes to drive there, park, sit down, get your blood drawn, and go home. And now there are actually convenient home allergy tests that allow you to take a finger prick and your blood sample can be analyzed using a lab by mailing away the card. Ultimately, the test isn't the most important part. The most important part is working with a doctor who's going to listen to you and understand your symptoms and make sure that your test results match up with what your symptoms are. Because that's what we want to treat. We treat the patient, not the test. Anyways, if you'd like to learn more about allergy testing or allergies, please subscribe. How do you interpret your allergy skin test results? When you have an allergy skin test, your doctor is going to irritate your skin or inject your skin with substances that you might be allergic to, like ragweed or dust mite. They also irritate your skin with something called saline or salt water. What this does is it gives us a comparison. You shouldn't have a really big reaction to salt water. So in general, the easiest way to interpret your test results is to look at what did you have a big reaction or welt to and compare it to how big it was when you were just injected with saline. If you have a big reaction, there's a high likelihood that you probably have an allergy to that substance. But most importantly, it's important to understand that just because you reacted to a substance doesn't mean that you necessarily have an allergy to it. In general, you have to work with your allergist to make sure the symptoms make sense. So for example, you might have a big reaction to cat dander, but if you don't have any symptoms when you're around a cat, I wouldn't worry about having an allergy. Does that make sense? If you have any questions, please let us know. Does allergy testing hurt? The short answer is, it depends on what kind of testing you choose. The traditional method of testing that's done in physicians' offices involves multiple needle sticks to see how your skin responds to different allergy triggers. For some patients, this can be uncomfortable because it involves a lot of needle sticks and itching and irritation of the skin. But you should always talk to your doctor about what's right for you, since there are also allergy blood tests that can be done at a local laboratory like Quest Labs or LabCorp, and there are also now finger prick dried blood spot tests which can involve just one single prick, which you can even do at home. Ultimately, the most important thing is to work with a doctor you trust to figure out the testing protocol that makes the most sense for you and your life. How much does an allergy test cost? A lot of people want to know what an allergy test costs, and it can be confusing. There's so many variables to take into account. The first variable is what is the contract your doctor has with your insurance company? The second variable is how much does your particular insurance plan cover? And then you have to think about your deductible, because even if it covers X amount, you may have to hit your deductible before it covers it. So it can be really confusing. The good news is, in terms of ballparks, if you're getting a skin prick allergy test at a local physician's office, it's going to cost somewhere between $300 to $500. Sometimes it can be more, but in general, that's a good range. If you're getting allergy blood testing done at a local lab like Quest Labs or LabCorp, in general, it can be anywhere between $100 of a copay all the way up to $1,000, so it can be kind of expensive. And then there are finger prick home allergy tests, and those tend to be cheaper because your doctor can control the cost and can often sell them to you for an upfront cost. Ultimately, you want to work with a doctor you trust, and you want to try to figure out your allergies using both an allergy test, but also a consultation with a doctor to figure out if that test result actually makes sense with your allergy history.